I will very quickly explain about the copper deficiency. So, first of all, where is the laser? There you go. Let me get things ready. Alrighty. So, can you see this? Copper is a trace mineral that our body needs to make blood cells, keep our nerves healthy, and run numbers of enzymes. We need them. And the risk factors for copper deficiency include somebody who underwent the bariatric surgery or some other absorption issue, or somebody taking high zinc. The zinc and copper, they compete each other in intestine when it comes to the absorption. So when we have a copper deficiency, of course, with more severe deficiency, you can see problems like anemia or white blood cells, bone changes, and in more advanced cases, a nerve damage. This is most important complication of copper deficiency. So let's talk about the severity of copper deficiency. Not everybody with copper deficiency should be aggressively treated. It depends. Mild copper deficiency usually show up as low or borderline lab numbers, but little or no symptoms. Maybe just some feeling tired or a little bit of immune changes that's very hard to prove. Moderate cases clear have clear low lab value, start to show things like anemia or white blood cells, but usually no really major neurologic issues yet. Severe cases are where copper is very low and we see multiple blood cell problems, bone marrow changes, and neurological signs like balance issue or numbness, spinal cord changes. The neurologic symptoms are especially important because they can be slow to improve. Even after we correct all the deficiency, it takes very long time to recover. For mild copper deficiency, we can usually correct things with just oral supplement. The goal is about 3 to 6 milligrams of elemental. We are talking about elemental copper, not like total gram of the tablet. You have to check the elemental copper in the label. Examples are, I'm not selling or like advertising these. Now Foods copper and Solary copper. So I told you 3 to 6 elemental, right? So check the amount and make it 6 or 3 or 6. It could be more than one tablet. You may need more than one tablet. We keep that going until the labs come back into the normal range, which often takes a month or two. When the deficiency is moderate, we still use oral copper, but at the higher end, around 6 to 8 milligrams a day. That usually means 3 to 4 of the 2 milligram tablets per day. If there is a 3 milligram tablet, then it's going to be two or three, right? We will also start a multivitamin that contains copper to help with the prevention down the road in the future. We recheck blood levels after 2 to 4 weeks to make sure the things are improving. If they don't get better, despite the additional supplement, it's not a matter of your diet anymore. This is a malabsorption problem. So we have to dig into why. Let's talk about more severe cases. In severe deficiency, we need to start with the intravenous copper because we have to fill the tank to quickly replace stores. The usual dose is 2 to 4 milligrams a day for about 6 days using a preparation like copper chloride. After we finish the IV course, that's not the end of it. We transition to oral copper again around 6 to 8 milligrams a day until blood levels stay normal. The neurologic symptoms can take longer, as I explained earlier, to recover, and sometimes don't really fully reverse, which is why we have to detect it as soon as possible and fix it early. After we start supplementation, we check serum copper and ceruloplasmin after 2 to 4 weeks to be sure the level is rising. If everything's on track, we keep checking every 1 to 3 months until the numbers are solidly normal. For people at for people at ongoing risk, for someone who had a bariatric surgery, there's no way we can reverse it, right? So we will continue to monitor every 6 to 12 months. Once we confirm that, yeah, it's solid, it never goes down, then we may do every 12 months. If someone is taking zinc, this is something important. Zinc, as I explained, zinc and copper, they compete each other. So if you are like consuming this amount of zinc, let's say every 8 to 15 milligram of zinc, if you have 50 milligram of zinc in the supplement, then the amount of copper supplement must go up one. So if there's 30 milligram of zinc, then it must be increased by two. If 45, then you must increase the copper supplement by 3 milligram. For people who continues to have risk factors such as malabsorption or high zinc intake, we recommend a maintenance dose of about like 1 to 2 milligrams of copper per day, usually from a multivitamin. You can use the copper like 2 milligram every other day. That's okay too. Eventually they accumulate. And usually you can use the multivitamin like a Centrum Silver or a Bariatric Advantage Lifelong. If there are no ongoing risk, we can stop the supplementation once labs and symptoms have remained normal, but we may still check levels maybe every 6 to 12 months. I would check it at the beginning every 6 months, but once we confirm that it doesn't go down anymore, it could be once a year or once every other year as well. The big points to remember are all doses refer to elemental copper, what I mentioned in this, not the weight of the copper salt or tablet. Catching deficiency early prevents permanent nerve damage. And finally, if somebody is on zinc, always keep the copper to zinc ratio in mind so we don't create the problem all over again. Thank you so much for watching.